Doesn't that intro just get you so pumped up for your first therapy session? Probably not. Most people actually say they're quite anxious, which is totally understandable. And that's exactly what we're going to talk about today. But before we do, welcome back to the channel. My name is Matt Ryan, a therapist located in the state of New York, and I'm really glad you're here today. Today, I'm going to walk you through every single question that's asked on an intake appointment, give you some rationale for why it's asked, and hopefully ease your anxieties about your very first therapy session. But before we do that, if you haven't already, please do go ahead and subscribe down below and hit the like button on this video. It is really helpful, but only if you want to. There really is no pressure. A few general comments to start. Most intakes are going to be quite similar no matter where you go, with of course slight differences depending on provider and location. Now, some people do call these intake assessments. Some people call them diagnostic evaluations. What we're really referring to is that very first appointment where you're asked a whole bunch of different questions. This appointment usually lasts about 1 hour and is conducted by one social worker or a counselor. I have seen it where a doctor is there as well, but this is typically more rare. Now, I'm going to let you in on a little secret. The intake is not completed for the sole purpose of collecting information, but really I'm always trying to answer 3 specific questions. The first question is, what is the problem? Or what is the diagnosis? Number 2, what level of care is required right now to address the problem? So, for example, does someone need once weekly therapy? Do they need twice weekly therapy? Do they need a specialist? And 3, I want to know, what is the plan? So once the intake is over, what are we going to do to begin addressing the problem? Are we going to start therapy right away? Are we going to refer to the specialist? We need to come up with a plan. Now, the best way to kind of answer these questions and to have a comprehensive assessment is to ask a whole bunch of questions, hence the many questions we ask during the intake. Now, the questions are not just randomized, but typically questions fall within 3 broader categories. We ask questions from a biological category, we ask questions from a psychological category, and we ask questions from a social category. In fact, some people call the intake a bio-psycho-social. So when we combine information from these 3 domains, we have a comprehensive assessment. Once we have that comprehensive assessment, we can do our best to answer the 3 questions. What is the problem? What level of care is required? And what is the plan? Now, a few things to also know before the first intake. And the biggest one is this, that we're not going to have perfect answers or clear answers all the time after our very first intake appointment. So we may not know exactly what the problem is, or we may not know exactly what level of care would be best, but hopefully we have some sort of starting point. And then finally, a lot of people tell me that they're like really anxious about having to describe their entire life story in great detail. The good news is you actually don't have to. Because the clinician is conducting an assessment that is organized, they will be the ones to guide you. They'll let you know how much information they need, whether they've had enough information or whether they need more. So the pressure is off to have to give an entire detailed autobiography. Allow the clinician to guide you. Now, with all that out of the way, let's jump into my intake assessment and go through every single question so we can talk about it more. Let's jump in. So this is literally the form that I use when completing an intake. One thing that's important to know is I usually don't go in perfect sequential order, but I will for the video. So the first thing you'll notice under intake details are these administrative questions. So medium used for session, that really means like, what form of therapy are you doing? Are you doing telehealth? Are you doing it via Zoom or your phone? Or are you doing it face-to-face? And then you'll see here questions about state the patient is located in or state the clinician is located in, as well as appropriateness of telemedicine for service delivery. So there's all sorts of telemedicine laws and regulations that are being developed. And so a big part of that is knowing where someone's located and also knowing where the clinician is located. And then finally, we want to know if telemedicine's even appropriate for the issues that someone is seeking out treatment for. In some cases, face-to-face or in-person treatment is best. And so you'd indicate that here. Moving on to our section called current assessment, you'll see here this prompt for chief complaint. Very simply, in the client's words or in the patient's words, this is what the problem is from their perspective. And sometimes we'll put this in quotes or in paraphrases, but we want to know what the issue is in their own words. And then we also have down here something called the history of present illness. One thing to keep in mind is that there are terms on here like illness and patient and things like that. This is actually a universal assessment which can be used in a hospital setting as well. So that's why you'll see those kinds of terms. But regardless, history of present illness is basically all the information, all the data, all the relevant history about the current issue that someone's seeking treatment for, right? So maybe what has life looked like over the last 6 months or over the last year? Things like symptoms or events that occurred, things like that. So we are collecting a good amount of information for this section right here. And then moving down, like I mentioned before, we have the psychiatric history. So this again is fairly detailed because it's very important for making that comprehensive assessment. We'll ask things about the first time you ever encountered a therapist, or the first time you took medication, if that's relevant. We'll ask about current medication, that kind of thing. And then moving on, you'll see here under this section of risk assessment, we're always assessing mainly for suicide and aggression or violence. Now keep in mind, these assessments are done with every single person universally, despite the reasons for seeking out treatment. And so when we think about risk factors for suicide and risk factors for aggression or violence, we're going to go through a whole bunch of things here. And so if someone does have risk factors, we're going to kind of write them out and explore them and talk about them here in this section. Same thing goes for aggression or violence. If there are certain risk factors there, we're going to talk about it, we're going to write it out, we're going to document it here. And we're also going to explore someone's history with suicidal ideation or self-injury, and we're going to write that down in this section, so collecting that kind of history as well. And the same goes for any aggression or violent behavior. We're collecting that history right here. And then from there, we're also going to ask about access to weapons or firearms. Obviously, this is an important question to ask. And again, every person that comes into an intake gets asked this question for obvious reasons. And then finally, at the end of those assessments, a clinician is typically going to make an assessment about the degree of risk for either violence and aggression or suicide. And usually they range from low, moderate, or high. And then depending on the risk status, some tweaks in treatment may occur or some additional steps may need to be done. So for example, if someone is moderate or high, we're going to develop a plan for that particular area. We're probably going to come up with a safety plan. We're going to have specific goals about that area, and we're going to write that down and kind of address that right here. And then we're also going to talk about protective factors, right? So what's preventing someone from doing those things? And we're going to write that down and explore that here. Next, you'll see substance use. This is fairly self-explanatory, but we're going to ask all sorts of questions about substance use and history. So types of drugs that have been tried, frequency, amount, that kind of thing. We're usually collecting both history and current use because we do know that this is very important when making any sort of assessment about mental health issues or anything like that. And then moving into the social section, which I talked about as well, I would say that these questions stand alone may seem a little, not in place, like in the overall assessment. You'd be like, why are you asking me about my education? I'm here for anxiety. But do know that when we combine all these questions together, we're really getting a good, strong sense of the person's kind of social background, social history. And so that's the point. It's kind of to combine these particular questions together. So you'll see here, we're going to ask someone about their description of upbringing, place of birth, siblings, family structure, things like that. Moving down, we have education. How far did someone go? History of learning difficulties, is that there? History of employment. We'll ask about marital status and history. We'll ask about the current living arrangement, meaning do you have roommates? Do you live with a spouse or a significant other? We're going to ask about cultural, religious, or spiritual beliefs. And also we'll ask about family history of mental health issues or substance use issues. Again, very, very important for that assessment. We'll also ask people about legal history, Has there been any arrests or anything like that? We'll ask people, and so this question here can often be very hard and triggering for someone. We will ask about different periods or events if someone's ever experienced abuse. And again, one thing to keep in mind is that if this question is really, really hard and really triggering, you can say that. This is nothing you have to feel obligated to answer, but something you can feel comfortable sharing with the clinician that you're actually not comfortable answering. And usually that's received just fine. You're able to answer and not answer whatever you are comfortable with. But do know that this is a question that most therapists are going to ask. And then, of course, we know that family support and involvement is typically very helpful in any sort of treatment. So we'll usually ask about current support. And although many therapists are not medical doctors, it's very helpful for us to have an understanding of the medical history or the current medical diagnoses, as well as knowing about any kind of physical health medications as well. And often we'll ask about PCPs and dates of last physicals, because we do know that oftentimes kind of the medical issues and the mental health issues can really be interrelated. So we always want to be doing our due diligence to ensure kind of proper care coordination and making sure people are being seen for both mental health and physical health as well. You'll see here that we have an entire section called MSE, or mental status exam. I will not go through every single aspect of this. You can actually Google this, but a mental status exam is something that is conducted during every intake appointment and usually conducted during every therapy session as well. If you're interested in that, I can possibly make another video. Do comment down below, or you can certainly Google it. There are tons of resources and videos about that. And then moving down, you'll see here a section called PHQ-9 and GAD-7. These are actually specific screeners for depression and anxiety. So PHQ-9 is for depression and the GAD-7 is for anxiety. Again, these are two screeners that you can Google and actually read and look at yourself, but these are things I typically conduct during each and every intake appointment. And I also ask someone, sometimes this is the first question I ask, but I ask someone what their goals are for therapy. So in their words, what do they want to achieve in the therapeutic process? So that's it for today's video. I do hope it was helpful. I hope you were able to learn something. Do go ahead and subscribe below, because I will be posting consistent content to this YouTube channel. Until then, I look forward to seeing you soon.